evening, dear viewers. Welcome to our today's chat with a very special doctor from Chittaranjan Park. We are here today specially to commemorate the Doctor's Day celebrated on 1st July every year since the past 32 years to honor the contributions and dedication of doctors in the country. This day was earmarked by the government to celebrate the birth anniversary of Dr. Bidhan Chandra Roy, a renowned physician and the second Chief Minister of West Bengal. He had played a pivotal role in the development of India's healthcare system. So, today we have with us Dr. Maneesh Paliwal, who is a highly experienced gastroenterologist and hepatologist residing in Pocket 40 of Chittaranjan Park. To take the chat forward, I have here along with me expert compare Jaya Ray. Over to you, Jaya.
Thank you, Anindita. And it's really wonderful to be here. It's this beautiful office and clinic of Dr. Maneesh Paliwal, and he is here with us today. So welcome to our talk show, Dr. Paliwal. Great to have you with us, and we're going to understand more from him about how his journey as a doctor started. And then we'll get on to his specializations and how we can really help people in CR Park, benefit from his services. So over to you, Dr. Paliwal.
Thank you, as she rightly said, and I'm very grateful that my name is Maneesh Paliwal. I'm a gastroenterologist by profession. The proudest thing which I've always introduced myself is not as a gastroenterologist but a son of an army officer. So, which is the best thing I think I had. I've got very good parents, and this clinic is basically dedicated to them. I call this clinic Gut, Liver, Obesity Clinic. Gut day is a very nice thing. We know that the biggest problem we all say start from the stomach, and that's almost true because today science has shown that our gut bacteria are determining our health, whatever we do. Similarly, the second thing comes as liver. Liver, we all know, it's very common for everybody. And third is, I'm finding, obesity as an increasing burden in the society. Because of our lifestyle, sedentary lifestyle, our weight keeps increasing, we develop constipation, and then the problem is never ending. So this clinic, as a gastroenterologist and liver specialist, is dedicated for people who have chronic problems of liver, chronic like fatty liver and other problems like constipation, problems like severe acidity, which is not getting resolved or which is chronic, and sometimes when it becomes dangerous. Some people have diarrhea. Many people have gas and bloating, and they say that everything is IBS. Although today IBS is not the in thing, it's basically understanding your intestine. So my clinic I have recently opened to dedicate it to the understanding and teaching, actually education about the gastrointestinal problem. Now, what is, as a gastroenterologist, I deal with severe acidity, heartburn, constipation, diarrhea, bloating. Sometimes you feel that your bowels are not emptying properly, what we call incomplete evacuation. Sometimes when you have significant weight loss with bowel problems, then if you get too much of acidity and you feel that your stomach is not cleaning because of too much acidity. And of course, liver related problems. There are very certain specific diseases which as a gastroenterologist I deal, like cancers of the intestine, cancers of the liver, chronic diseases like colitis, in which there is a lot of bleeding, when we have bleeding from the back passage, and when we have gas and weight loss. They are very specific problems which require a proper evaluation. Now, let me bring it to you. A gastroenterologist doesn't mean an endoscopist. Gastroenterology, endoscopy is just 1%. And rest all is a proper diagnosis and a proper therapy. And today we see that most problems are stemming up from our lifestyle, from the way we are eating, from the way we are working, And of course, stress is the biggest killer. Stress doesn't impact the heart, it impacts the intestines much more. We all know that.
So there is a term called gut-brain axis. What
Yeah,
about that?
that's a very interesting term. See, you see gut-brain axis. You see, if you look at the gut, it is very sensitive. Whatever we eat gets digested, or we get feel happy about it or feel troubled about it. Intestines have a lot of nerves, and these nerves, in fact, our system of the intestine is known as enteric nervous system. This is directly linked with our brain, and actually people say that first the disorder was gut-brain axis. Now it is, previously it was called brain-gut axis. Now they are called gut-brain axis disorder. Why? The gut directly impacts the brain. I'll just tell you, it will be surprising for you to understand that people who get dementia, people who get stroke, it is their intestine bacteria which is responsible.
That's what I was getting to understand.
Yeah, this is the intestine bacteria. People, it's like so common that two people of the same family, one of them is thin, other is overweight. Why? Because their intestinal bacteria are different. And now we have therapies, and now we have some lifestyles and food habits which can determine our intestinal bacteria. It's like, so the nervous system from the intestine is actually affecting the brain.
So
And thus is
lots
the
of
gut-brain
time,
axis.
lots of time in these problems, I have seen the doctors give these nerve medicines, and so is it okay to take those medicines?
Look,
Like they are sort of treating the brain, not the gut.
No,
Is
that
it?
is where I will tell you. When you have certain chronic problems, there are two types of problems which will occur. One of the problems which we call is motility problem, or in Hindi we can say intestine ki chal ki problem. What happens here? The nerves of the intestine are under constant stress, and they are actually suffering from a problem which is impacting the brain. So if you would not affect the nerves and give treatment of these nerves, your intestines are never going to recover, and indirectly it will impact your brain. It is obvious also, just think about it. Suppose somebody has major constipation or major gas, and believe me, gut bacteria is linked to depression. It is one of the common cause of major depression. So you have to actually, as a gastroenterologist, understand the person in totality before you can prescribe a medication, to understand what is like we wear tailor-made clothes. So then you decide after a period of time that his intestines are not responding, which means her nerves are under super stress, and you have to treat them, and the dosages are very less. We don't use dosages which are prescribed by a regular psychiatrist, or we don't require that, and we are not saying this is a psychiatric problem. It is actually a problem which is very chronic, and this needs to be addressed like a tailor-made therapy, and each person will require a different drug depending on which part of the intestine is getting troubled, whether they have more diarrhea, whether they have more constipation, whether they have more stress, and all these things are very, today's science is in the era of being specific. We all know about Chat GPT now. Over its last 6-8 months, it has taken over the world. Even Google is getting threatened by it. So
it's basically you are saying that we customize a treatment for a patient, and that is only possible after you evaluate a patient. You spend a lot of time with the patient. You understand where is the origin of the illness and how has it progressed in the system, and then accordingly then the doctor will prescribe the customized treatment for you. So it is a very scientific and logical process, and there's nothing to be scared about. Doctor, we also have this notion, especially senior citizens, that they feel very scared to change doctors.
yes, I agree. I would agree that if you are familiar with something, what is very important in our human life is that we try to live in a comfort zone. Unfortunately, we are going by a lot of old wives' tales. What is happening is gas ho rahi hai, ajwain kha lo. Not that these don't work. You see, gas as a symptom can be very straightforward because of our lifestyle. Gas can be very straightforward with what have we eaten. But gas can also be a problem of a cancer. Constipation is one of the commonest disorders on earth. Okay? And out of fear of changing doctor, especially if you have constipation and you have noticed black stools, or if you have, and that even once, or you have noted a good amount of blood coming in your stool and you are above the age of 55, it is very important that you get out of your fear. It is very important that you realize this and boldly consult your physician that I am not getting better with this, I should seek a specialist. Take help from him. They would know that yes, this is something which a physician should evaluate more. Of course, today is this era of speciality where a physician can give very good medications, and with experience you become very nice. But sometimes you require for specific people who have chronic problems which are not getting relieved, rather they are getting aggravated, you come out of your fear and show to a specialist so that before things turn bad, especially if you have lost weight, especially if you have lost your appetite, especially if you say you have profound weakness, that they get properly evaluated. Because in a lot of people, chronic problems can be handled only by a specialist, because controlling a problem, giving therapy and treating a problem fully is not always going to be easy. And as a physician who is who knows everything about you, will realize that things are not looking bright. But the most important thing is you have to yourself feel that I am not improving after 1 month therapy, 2 month therapy, 3 month therapy. I really would like to bring to the residents, anybody who would listen to this, please understand, not everybody requires to come to see a specialist like a gastroenterologist. But if you have chronically suffered and the problem is recurring all the time, one. Second, if you have certain alarm signs. Now these alarm signs are what? Which can predict there is something bad going on in your intestines, stomach or liver, is one, weight loss. If you have weight loss which is more than 5% of your body weight in 3 months or 10% of your body weight in 6 months. Second, if you notice black colored tarry stools or smelly stools. Third, if you feel that your constipation is continuously increasing, if your diarrhea is continuously increasing, if you have blood passing in your motions, one, if your appetite is lost and it is not recovering, and you got severe pain in your tummy which is not getting explained, which comes and goes, but it is not going. These are known as alarm signs. And or you have a family history of a relative, especially father, mother, brother or close uncles and aunt who suffered from cancers, especially of the intestine, especially of the liver. They should seek out help. We are all there to help you. Believe me, as a gastroenterologist, if I see 100 patients, only 5 or 10 or maybe 15 will require endoscopy because they have exhausted everything. And sometimes we have to see inside the intestine. That's what's going wrong. Today, because of our lifestyle, we are getting a lot of young people having intestinal cancers. Obviously, endoscopy is the only way to diagnose it and actually take samples to prove it that it is a cancer. So, gastroenterologist doesn't mean like an endoscopist. That is just a part of your training. In fact, my training, I would have spent only 15% time in endoscopy and rest mostly in understanding the intestinal tract, which I would say would have hundreds of diseases and each with different combinations. So, get out of your fear, especially if you have alarm signs and you feel after a few weeks or few days of therapy, the problems are worsening and not improving. And it is best to take an opinion, just understand that everything is going okay and go ahead and get it sorted.
Correct. He's right. Dr. Paliwal is absolutely right that before things go out of your hand, when you are getting the initial signs of alarm, like he said, of the symptoms that he discussed, please come and show it to a specialist and seek help. Because unless you seek help, the problem will only worsen. And still things are in our hands. I think we should seek help and get ourselves treated. And I don't think there's anything to worry, because doctors are here to help us, and they will definitely not take any advantage of any of our resources or any of our situation. Trust me on that. We keep meeting a lot of people, and we keep meeting also a lot of specialists, and they study so much only to help us.
Yeah, of
So,
course.
so residents, please come forward and seek help of Dr. Paliwal. He's a super specialist, and we are extremely happy and privileged to have him in our colony. It's a one of its kind clinic here, which has all the facilities for treating gastric problems, stomach problems, liver problems. So please come forward and seek your help. So thank you so much, Dr. Paliwal, for talking to us. And residents, his clinic address is 40 Pocket 40 by /61. So 61, it's right on the main road opposite the Airtel store on the Pocket 40 Siar Park main road. And we'll also share his phone number. Please pick up the phone, talk to him. You can even talk to him on the phone, and he will be only happy to give you some basic advice, and then you can come and meet him. So thank you, doctor.
Thanks, sir.
Thank you, viewers, for joining us. We'll see you in our next video.